Hi, Mr. Bill 1911 here, and as always, if you have any history of any cardiac, respiratory, or orthopedic condition, or are over age 30, please consult a doctor before starting an exercise routine. This is part one of age and injury accommodations. This one I'm going to go more specifically into some limitations which might be appropriate after certain surgical procedures. First, I'll go into shoulder procedures, which I'll simplify into rotator cuff repairs and shoulder replacements. I haven't had the second, but I've been through the first, so I know some of this personally. Generally speaking, after you've had a rotator cuff repair, the tendon will be reattached to the bone surgically, and you will be limited to passive range of motion exercise only for typically the first 6 weeks, possibly a little bit longer, depending on your healing. And that basically means you either will be using your other extremity to passively move the operative side, or a physical therapist will do that for you. And after that, it progresses through gentle strengthening. How aggressive it can be at that point can depend on your prior conditioning and how well you're recovering. Shoulder replacements, there will be similar limitations, except they're probably going to go on a little bit longer. You might be looking at more like 6 to 12 weeks post-operatively, passive range of motion, and then very gentle, active strengthening will begin. But you're also generally going to be looking at more permanent long-term considerations for safety and to preserve the function of that replaced joint. And that would be things like limiting or very basically avoiding overhead pressing movements, chest pressing movements. I've seen one exception to that who was a personal trainer. He said he could knock out some respectable reps with a like 225 on flat bench. I would not recommend that. Even if there is no initial pain or discomfort from that, if you use that joint too forcefully, you can accelerate the wear and be looking at a sooner replacement of that, because they do have a lifespan, and the earlier and younger you get those joints replaced, the more likely you're going to have it replaced again at a later time. Next up would be hip replacements. Very broadly, I would separate those into cemented versus cementless, and that is where they would take the femoral portion and cement it into the femur, and the cup is going to be cemented into the hip. And generally speaking, those people can do weight bearing as tolerated very soon post-op. The other is what they call cementless, where the femoral portion most often, sometimes the socket portion, are porous, and they're designed for the bone to grow into it and fully secure it. Those, the person will generally go through a progression of non-weight bearing to touchdown to partial to as tolerated. The progression will depend on the findings of the surgeon, and that is very highly individualized. Long term, you're looking at limitations such as not crossing your legs, not flexing the hip past 90 degrees, and avoiding impact or twisting type stresses. So if you like to play tennis, you might want to limit it to doubles. You just literally have to cover less ground, so you don't have to move as aggressively. And if you do like to exercise, do strength training, you would be limited to probably squats without weights, and again, not flexing past 90 degrees. I do know one personal exception to that. He was a physician who was a pulmonologist, been a competitive bodybuilder, and he had a partial hip replacement, and he would just do some very light leg curls and extensions before, and then he could do very light leg presses, not flexing past 90 degrees at the hip afterwards. But again, that is the exception, not the rule, and not something I would necessarily recommend. Knee replacements, there can be similar restrictions. The flexion restrictions can depend on what the range of motion is post-operatively and what they gain back in physical therapy. You do not want to exceed those limitations as recommended by your physical therapist and your orthopedic surgeon. Again, you would also want to avoid impact or twisting type stresses. So running would probably be out, walking would be good. I once had a patient who said her physician told her she could resume skiing afterwards, but again, we're probably not talking Olympic level type skiing, so she'd have to be very careful not to do it very aggressively. And again, you have to keep in mind that these are artificial materials which are now in your body, and they do not potentially regenerate such as a normal, healthy tissue might. And that's your fit tip for today.